Yes, good morning. I'm Kevin Young. I'm the Vice President of Medical Affairs and Chief of Staff at Waypoint. I'm responsible for working with all of the physicians that work at Waypoint to provide sort of ongoing care, monitor for quality, and just make sure that we're innovating programs to be able to provide the services that our patients find necessary and help them to move on to the next stage in their journeys. The Waypoint At Home program is something that is brand new and we're quite excited. We're a specialty mental health hospital that provides mental health, addictions, and geriatric care. And traditionally, most of our efforts have been on the care that's spent within the walls of the hospital, and people might come into the hospital for an episode of care. And we pride ourselves on making sure that we're up to date and providing the most evidence-based care. But the hospital itself is a very artificial environment, and people often are not as connected to their communities as they might otherwise be, and are just at a different stage in terms of the care that they need and the supports that they need. So when they leave hospital, it can be a very big transition back to the community. It's very similar to if a patient comes into a general hospital with a physical care need, they might need some help to restore some of their physical capabilities and get back to normal. Well, the same thing happens around mental health and addictions care, where somebody is ready to go back into the community but may still need a helping hand in order to reform some of those community connections, to have some ongoing support, counseling, to be able to apply to programs that might help them, or even some physical care needs that go together with their mental health needs. And so this program is really designed to make sure that that transition from hospital is as seamless as possible, that people see the care as being a continuous episode of care, and that we're helping people to really be successful in their ultimate journey and not just concentrating on the hospital stay itself. So we have a partner called Bayshore that we're using to help us to have all of the right staff for the at-home program. The staff can include everything from physicians, right through to personal support workers, behavior support therapists, social workers, personal support workers, all kinds of different people. And we have a coordinator at Waypoint that gets to know the patients, understands what their needs might be, and it may even change over time. It's a little bit different than the traditional outpatient programs that we have, where patients would, come in for an appointment, or where we might surround them with sort of a team of people, because these are also traditional home care services. And the idea is that over time we can start to connect people with community services, connect people with other home care services, and that this program will just help to transition them back into the community again. So in theory, it's open to all patients. There are some people that require an intensity of service that would be much higher, and we have specialized teams that are able to help those people, and those have been in existence for a while. There's also people who have very good support networks, or for whatever reason don't need that level of service, and so even though they might qualify, they just may not benefit from those services. And so we're trying to find people that are somewhere in the middle, where they need that extra help, that extra helping hand, and we can change the intensity and we can modify it over time and just make sure that we're supporting them in their journey. In general, in the healthcare system, we spend much more money treating physical ailments than mental health ailments. And so I think this program does a variety of things. The first thing is that it allows us to continue to assess and to understand how patients do when they leave the hospital and they're back into their community environment, and their needs might be completely different. And so instead of making assumptions of what they would need and then delivering the services based on that, we can continue to assess, we can continue to understand what's working and what isn't working, and we can modify that treatment to make sure that somebody is being successful. It also opens up to people the types of services that they might have if they had a heart attack or a stroke in hospital, and then eventually were able to get home with some help and to get back into their normal environment. And so by doing this, it destigmatizes mental health, and it makes sure that people see it as being traditional healthcare and things that people need in order to succeed, and that many of us will benefit from over our lifetimes. So there are lots of general hospitals and even some specialty mental health hospitals that have at-home programs, but traditionally they have really focused on the physical healthcare needs. And so the uniqueness of this program is that we're focusing not only on the physical healthcare needs, but really putting an emphasis on the mental health and addictions needs of people and making sure that that's front and center, making sure that we have the right staff, the right ability to understand what's going on and assess people to be able to provide that level of support. And in that sense, we're not aware of any other hospital that's doing this type of program, and we're quite excited that it means that care can be continuous throughout one's journey in the healthcare system. So at Waypoint, we're always trying to be innovative and think about what is going to benefit patients and what's going to benefit the system. We're always looking to develop partnerships in order to be able to help us to achieve that. And I think by thinking outside of the box, by thinking of healthcare as more than just what happens inside of hospitals, these are the types of things that will help us to be successful in delivering very effective, very cost-effective healthcare that really is the type of thing that people are looking for. And I think at the end of the day, people want to be looked after at home in the community whenever possible. And so programs like this will really help to bring that to life.